Hi everyone, my name is Dr. Jacob Goldberg. I am the owner and chiropractor here at Redefine Your Spine, and I'm going to give you guys an office tour, so you can head right with me. So as we enter into the office, this is our waiting room. This is where we're going to have you do some patient paperwork, fill out a couple forms. We do have some coffee and some tea that you can help yourself to, and we do have some water to make sure you're hydrated. So this is the waiting room. You can head right with me. This is our rehab room. So before we get kind of started in here, I do want to let you know we're definitely not your typical chiropractor. We do corrective chiropractic care, specifically known as Chiropractic BioPhysics. So what Chiropractic BioPhysics focuses on, it focuses on therapeutic exercise, spinal remodeling traction, and the third thing that we do are adjustments. We also do something specifically with the adjustments. It's called mirror image adjustments to make sure we're shifting the spine to the correct position. So the first thing over here is our therapeutic exercise. So this is our power plate. We do a lot of our mirror image exercises and just exercises in general on here, like mobility work and stuff like that. So we see a lot of patients that come in here, they'll have anterior head translation, or they'll have a lot of curvature in their mid-back, or their spine may just be completely over to one side. So this machine, we love to utilize it because we get a ton of muscle contractions on it, and it really helps speed up the whole process on shifting things back to the normal position. Over here we have both of our traction devices. This is our 3D dinner roll table, so we do a lot of scoliosis type tractions on here, and we can do tractions through the neck, we can do it through the mid-back, the lower back, and the pelvis to make sure that we're shifting the spine back to the appropriate position. And then this is our universal traction system. So this machine, we can definitely do tractions through the neck, the mid-back, the lower back, and the pelvis as well. Another aspect of this machine that we can do is cervical axial decompression. So a lot of times people come in here, they have really acute neck pain. So after we figure out what's going on, a lot of times to calm the neck down, we'll do some decompression on it. So what this machine does, we place the harness underneath the chin and the back of the head, and it gradually distracts the head up, which opens up the discs and it opens up the joints, so it helps allow the inflammation to calm down, and it makes the neck feel a lot better in a lot of cases. So that is what makes this machine pretty cool as well. So this is our rehab room. We do spend a lot of time in here, and this is how we get the spine shifted back to the normal position, or at least as close as possible depending on what the patient comes in with. The next room, you can follow me, this is our exam room. So this room, this is where I get to learn a little bit more about you, figure out what specifically is going on with your medical history, and then we'll do any other exams that we need to do, whether it be orthopedic testing, neurological testing, but really this is where I get to figure out what's going on with you, and then this information is very important when I come up with your care. So this is the exam room. This next room is the adjustment room. So after we figure out what's going on, what kind of alignment you have based on your x-rays, this is where I can do the proper adjustments, make sure that we get rid of the restrictions, but most importantly, getting rid and getting your spine back in line. So if you're shifted this way, make sure we're doing the adjustments to shift you closer to normal. So this is our adjustment room, very important about what we do in the office. And then down the hallway, you're going to see our digital x-ray. So we have this in-house, it's great. This is how we can figure out what's the root cause of your problem. So this is our digital x-ray room, and we do that in-house. And lastly, this is my office. So this is where we're going to discuss your x-rays, and we're going to go over a game plan on how to get you back to the best position with your spine, but to get you feeling at your best. So this is an example here. This is a patient here. You can see there the red line. They should be where that green line is. And then you can see this is where the neck should be. So we go over this in a lot of detail before we start care, so we know exactly where the problem is. And this is just some of the x-rays that we take in here, depending on what you have going on. But this is important because it gives us a baseline, and it tells us what specifically is wrong imaging wise so that I'm doing the best job shifting your spine back to normal or as close to normal as possible. So once again, this is Redefine Your Spine. I'm Dr. Jacob Goldberg. I'm the owner and chiropractor here, and I look forward to seeing you in our office. Thank you very much.